This is the Art Beauty Podcast, where we are always reaching for truth and beauty. Remember, the people and the brands featured on the show are not paying to be here, which means we get to ask them the questions we know you want answers to, because you deserve to be informed so you can make the best beauty decisions for yourself. Hi, everyone. I'm Amber, and today my fabulous co-host is Dr. Michelle Henry. She is a board-certified dermatologist and the founder of Skin and Aesthetics Surgery of Manhattan. I want to say welcome to the show, Dr. Henry.
Thank you for having me. I'm excited to be here.
I am so excited to be here. I got to tell you, I spend a lot of time on your social media, and it is fantastic. I love it.
Thank you. Thank you.
I have seen a lot of buzz, and we got to talk quickly before getting on here about Morpheus8.
Yes.
And I feel like, I don't know, so many people are looking for that, skin tightening, skin improvement. And you mentioned this is actually one of your favorite treatments. So I'd love if we could kind of delve into that today.
Yes, so it absolutely is one of my favorites. So Morpheus8, everyone's heard of it. It's the celebrity favorite, but for good reason. It's everyone's favorite. It's a microneedling and radiofrequency device. So I think microneedling is pretty self-explanatory, but when we're doing lasers, kind of the limiting factor with regard to lasers is the skin. The skin is such a robust barrier that sometimes we can't get the energy or the heat exactly where we want it to stimulate tissue and get, robust lift or robust improvement of scarring or fine lines and wrinkles. And so Morpheus8 does just that. So we have these needles that enter the skin, and after the needles have entered the skin, it releases radiofrequency. There's a face tip, there's a tip for on the eyes, we can use it on the belly, so it's very versatile. We can use it in all skin types. So in my office, I'm using it for skin tightening, for folks who want that glass skin, that poreless, perfect glass skin, for tightening the belly. So it's a part of my mommy makeover. So all of my mommies who
I mean, coming into summer, let me tell you, that's something that we all want, so let's kind of take a step back, so we're talking about this is a microneedling device. You're using RF energy. So, you kind of said this is going to give us a glass skin. This is going to give us, some improvement to skin laxity. When we're talking about the body, which is a tricky area, right? And a lot of people have that stomach laxity. What kind of results are you seeing?
I'm seeing great results. You know what I love to do? I love to mix the Morpheus with a bioregenerative filler. So one that I often use is Radius. So Radius is made of calcium hydroxyapatite. And so what that does, it's a suspension that helps to stimulate collagen. So what I do is I will do a really diffuse layer of that filler first, and a few weeks later, I'll do the laser, and I just kind of alternate, and it's kind of just super boosting that collagen production and amplifying each other, and you get really great tightening that way. And so you can get pretty impressive results.
I mean, who doesn't want that? And I'm finding that, as a lot of women, as we get into our older ages, whether or not we've had kids, we're starting to see that laxity on the stomach, on the knees. And there hasn't really been something, but I've heard a lot of buzz about the Morpheus8. When it comes to the procedure, what does that entail? Like, what kind of downtime are we looking at? What kind of pain are we looking at?
It's funny. So many patients come in and they are just shaking in their boots. They're worried about pain. They heard on TikTok it's so uncomfortable. And I don't know where this misinformation is coming from.
Oh, good.
I've used
Okay.
so many microneedling devices, and I think honestly this is one of the more comfortable devices. So we do topical numbing for everyone, and I do in my office, I use a pretty robust numbing cream. I'm a baby, so I baby everyone. I understand being afraid of discomfort, but most tolerate it beautifully with just the cream. For those who are really sensitive, we will do a little bit of a nerve block, and sometimes we give a little bit of laughing gas. My patients call it sweet air, which I've never heard before, but we give a little laughing gas. But it's really well tolerated. And in terms of downtime, very little. So, maybe run this for a few days. So with moderate settings, maybe 2 days, maybe 3 days of redness. And that's really it.
So no, we're not going to have that peeling, that flaking,
Not at
things
all.
that you could theoretically then cover up with like a makeup like Oxygenetics, which I know is sort of breathable foundation. Yeah.
Yeah, that's perfect. Sometimes you can feel like a tiny bit of scabbing at the sites of the needles, but very tiny. You're not going to get that shedding and peeling that you get with like a proper resurfacing laser.
Which is great to know. And I know, especially like, we're in the summer right now, whether or not it feels like it outside. Is this a procedure that we have to be careful? I know with everything, we should be protecting our skin no matter what, every day, indoors, outdoors, with some sort of SPF broad spectrum protection. But is this something that we should be kind of putting off to the fall? Is this not a great summer procedure?
So, we never want you to get lasers if you're going to have a ton of sun. But some of my
Right.
patients are like, it's summertime. I'm just going to work. I'm not laying out.
Right.
Is this a laser that I can use? If I had to choose a laser for you to use during the summer, it would be this. And it's because
Okay.
radio frequency is colorblind. We're not targeting pigment. So a lot of my patients that are coming in for lasers for melasma, or, they want to get rid of their freckles or other, pigmented concerns, I'm not going to treat them during the summer. It's a
Right.
waste of their money and a waste of their time. But we're not treating pigment with radio frequency. So it's one of those things that I will use during the summer, but I almost have my patients sign a contract saying I'm going to be really good. I'm going to wear my sunscreen. I'm going to be very well behaved. But it's something that I do in the summer months with patients that are responsible.
And I feel like this is the time we're all going for that no makeup look. We also have all these events that seem to really ramp up during the summertime. Would you consider this sort of as like a good pre-event type of a procedure? Or do we need like a series of them? Like, how is that done?
So you do need a series of them. So this is not
Okay.
something I would get right before an event. It's something
Right.
that I would plan well in advance, at minimum a month. You
Okay.
really see the maximum results will be seen at about 3 months. At one
Okay.
month, you will start to see some improvement, and a little bit earlier, you'll start to see just a little bit of a glow from the microneedling itself. But at about a month, you start to see the early changes from that collagen stimulation. So I would say at least a month before a big event. I like to do about 2 or 3, depending on what I'm treating, and also depending on the severity of what I'm treating.
Okay.
And then once we kind of get the improvement we're looking for, then in terms of maintenance, I usually say one or two per year just for maintenance. And as we get older, we're just rapidly losing collagen. So for maintenance, it's nice to do anything that's going to induce a little bit of collagen. It's just nice for everyone, even if you don't have a critical concern.
I'm glad that you're sort of bringing this up. I always, I guess, thought of microneedling as somebody like really good if you have textural issues, right? So acne scarring. Um, but is it like, is it just good for general like wrinkling, skin tightening?
No, I mean, I use it for, yeah, it is.
Okay, yeah,
So yes, you
okay.
hit it on the head. So absolutely, it's great for skin tightening and wrinkling, and also great for acne scarring. All of these issues are having a deficit of collagen. When you have an acne scar, that pimple has gobbled up your collagen. Now you're left with a divot. And so the solution is really the same. So it works beautifully for both.
And you mentioned before, because we're not targeting pigment, is this good? Because I know certain lasers with different ethnicities, I myself, my mother's Korean. So, people are always like, be careful of that post inflammatory hyperpigmentation. Is this something that you think is safe for all, for everyone on the Fitzpatrick scale, or is it
Absolutely.
okay?
I use it on my very, 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 fair porcelain skin patients to my very, very deep, rich mahogany colored
Right.
patients. So everyone, the full spectrum can benefit safely. So absolutely.
Okay, but again, I always like to manage expectations and we keep it real on this podcast. If you were looking for this skin tightening, this is not going to be overnight. It's not a one and done. So you're really looking at, if it's one treatment a month, or you said a series of three, right? Doing
Yeah,
like
two
what?
to three, depending on what your goal is.
Spaced what? How long apart?
A month apart.
Okay, so you're talking about 2 months and then another three. You're talking about, 6 months before you're really starting to see significant results. Yeah.
Could be, yes.
With that. But I just like to keep people in mind so that people don't think, "Oh, I'm going in here and in a month I'm going to look like, you know."
When a month you look in a month you look better, and 2 months you
Yeah.
look even better. In 3 months, you're now getting the maximum results of the first treatment. So you're
Okay.
still seeing that incremental improvement. It's not that you'll have it and then at 6 months you're like, wow, I look great. You'll see that you look better, throughout that period of time.
No, I hate to put you on the spot, but I feel like you've got access to so many fabulous devices and the technology is always changing. I feel like it can be sometimes overwhelming, even for myself, who's been in the
Yeah.
beauty industry forever. How do you like this compared to something like a CO2 laser or fractionated laser?
So they're different. Fractionated lasers are great. I use them. I've used them for many, many, many years. It's more kind of superficial resurfacing. Um, I find that I like the microneedling better for deeper scars,
Hmm.
deeper wrinkles. I like Fraxel can work quite well, or fractionated lasers can work quite well, or more superficial resurfacing for finer lines, for dyspigmentation. So if you have, freckles, any, photo damage, anything like that, those fractionated resurfacing lasers are going to help. CO2 is great. CO2, we have many limitations. So CO2 is not something for everyone. So if you're someone who has more melanin, you do not want to use it. Even if you have hidden melanin, you want to be really careful with the CO2, because it can be less predictable, but in the right patient, you can get beautiful results. And in some CO2 devices, you can play around with the settings and use it on darker skin. But for me, because I have to make the setting so low, I often lean more towards using something that I can get more robust energy, instead of using something that I have to do very low in multiple treatments.
Right.
But that's just my own personal preference.
And now I know that, you're located in New York City, probably one of the
Yes.
most expensive places in the world. And we know that costs obviously vary based on provider, but of certainly location. Is there a sort of ballpark for the Morpheus?
Yeah, I mean, I think there's a wide range. I'd say anywhere from maybe 1,000 to
Okay.
2,500 or more. But probably 1,000 to 2,500 is probably like ballpark. Maybe I've heard of some that are like three, but that's kind of the rough range for the treatment.
I mean, I'm going to say, listen, that's not a little amount of money, but I always tell people, if you are spending $1,000 a year on a skin cream,
Mhm.
maybe and expecting the same kind of results that you're going to get from something like this, maybe you want to kind of reevaluate your beauty budget, right? Because I think that you're not going to ever get the results from a cream or a jar that you're going to get from a needle, that you're going to get from a laser, that you're going to get from a knife,
Yeah, yeah, you
right?
can't, and most things that say that are brilliant marketing. But yeah, oftentimes you have to make that investment to really get the robust results, and then your skincare is going to help to complement that and maintain your results,
Yes,
and really,
absolutely.
yeah, so you don't waste your investment, but you probably need a more robust treatment.
Now, I know you are a busy woman. You've been working all day, but before I let you go, on the topic of skincare, I always love
Yes.
to ask doctors, derms, like, what are you loving right now? Are there products that you're really like excited about? Or is there any new technologies that you've sort of been privy to that you're like, this is really cool?
It's funny, skincare. I use so many different products.
Same
Um,
role.
yeah, it's tough. What am I using right now? I always have loved Elastin, so I use a lot of Elastin
Hmm.
products. Um, I like Skin Better. They have great sunscreens that work on all skin types. That's great I really love that. Right now I'm actually using a cleanser by Hourglass, which I really love. Hourglass
Oh,
now has skincare, and their Hourglass cleanser is really fantastic.
I,
Um,
I use their hourglass eyeshadow pen or
yeah,
pen, like the pen is my favorite. It's
yeah,
my fave.
the makeup and the skincare is quite good. What else am I using that I love right now? I use a prescription retinoid twice a day, every day. Um, what else? Yeah, what moisturizer do I have on right now? Let me think. I'm actually using a Mario Badescu moisturizer right now. I don't know if it's new, but it's their peptide mask moisturizer. I really like that.
I have
Yeah.
to say your skin is glowing, so
Thank
I
you.
always have to ask. And on the sort of in-office procedure front, is there anything that you're hearing about that kind of has you excited? Or people coming in and asking about things?
Yeah, everyone's into this regenerative medicine right now. So
Mhm.
anything that's gonna optimize the way their body produces collagen, they love it. Everyone's really into rejuvenation. So people want to delay having big procedures. So whatever they can do to not, look like their grandmother, who I know they love their grandmothers, but they come and they're like, this is the face that's coming. And I just want to, I love her, but I want to see, how long I can maintain my youthfulness. So it's all about rejuvenation. It's all about collagen induction, using these lasers to induce collagen. It's all about, that natural makeup free look. So more
Yeah.
and more people are talking about not just wrinkles and lines, but, pigment, because they want to go makeup free, and that mascara and gloss look. They want that. What is it? The clean girl aesthetic? I forget what
Oh
it's
my
called.
gosh, I can't
I
even
don't
keep
even know. I
track with
can keep
these
up.
on social media. But yeah, it's that beautiful even skin
Yeah,
tone.
exactly.
Um and what are you liking for that? That's working with the pigment.
I mean, I use the Pico Shore laser a ton. That's a
Yeah.
workhorse in my office. Also great for all skin types. Good for melasma because melasma is so persnickety that if the laser is too disruptive, melasma will flare. So yeah, the Pico I use a ton.
I absolutely love that. I want to thank you so, so much for being
You're
on with us
welcome.
today. If people want to come and see you, and you've got some incredible before and afters on your website,
Yes.
where should they go check those out?
So you can find me. I do a lot on social media, so you can find me on Instagram, and that's just Dr. Michelle Henry at Dr. Michelle Henry. And my website is skinned and aesthetic surgery.com. But we do a ton on social media. We do a ton of before and afters there, and are super interactive. So you can ask me questions there as well, and I will get back to you. So that's where you can find me.
Amazing. Thank you so much, Dr. Michelle Henry. And if you have questions you want me to pass along to her, I'm always happy to do so. You can email me at hello@artbeautypodcast.com. Find us on Facebook, Instagram, and YouTube at Art Beauty Podcast. And as always, we will see you next Tuesday, hopefully maybe a little bit tighter, or at least on your way to feeling that way. Thank you.
Bye.
Bye.